Now, in the first risk factor, number 1 is lifestyle, in which age. So, the risk of miscarriage is highest among couples where the woman is more than 35 years and the man is more than 40 years. I have lifted it directly from the ISHRAE guideline. The risk of pregnancy loss is lowest in the women aged 20 to 35 and rapidly increases after the age of 40. Okay, stress is associated with RPL and no evidence that stress is direct cause of pregnancy loss. Occupational or environmental exposure to heavy metals, pesticides and lack of micronutrients may be associated. Smoking could have a negative impact on the chances of a live birth. BMI, that is overweight or underweight, can affect, and alcohol consumption also can affect. Okay. Number 2 is genetic. So, 3 to 5% of the parents carry balanced translocations, and in the general population, 0.7% of them can actually have a, some kind of a balanced translocation. So, according to this, what we have to tell is, so when there is an RPL, most of it is actually embryo itself will have some kind of genetic issues. This is the embryonic problem, aneuploid embryos. And in 2 to 5% of the patients only, you will actually have a parental karyotypic problem. Right? These can be of 2 types: reciprocal translocations, inversions, or Robertsonian translocations. I will not go into the details, just write these in the examination. You can, deal in detail if you are interested. You can read up. So, genetically abnormal embryos, that is embryonic factors, actually, they can look normal also or they can look abnormal. Most of the times, you will be surprised that genetically abnormal embryos, they look absolutely, they will be grade A embryos, but they will be, have genetic problem. Right. So, the ISHRAE guidelines tells that parental karyotyping is not routinely recommended in couples with RPL. However, if there is a prior child with a congenital malformations, family history of offspring with unbalanced chromosomal composition, translocation detected on analysis of embryonic tissue, then you should offer. And what is the best is actually RAACGH, which is actually recommended by ISHRAE. Okay. Okay, so the karyotyping is failure to culture and cannot distinguish between maternal contamination and euploid female fetus, and FISH is limited to analysis using selected probes. Okay, now genetically, these are the things where you have to offer: genetically abnormal embryo, prior malformed baby, or family history of some genetic problem or unbalanced composition. Okay, so you offer parental karyotype. So, parental karyotype, you can have any of these problems in 3 to 5% of the RPL cases. So, if they try to conceive naturally, or they can use IVF with the biopsy of the embryo, or they can use the donor gametes. If they try to conceive naturally, what happens is, you can offer an invasive testing or an NIPT, that is a non-invasive testing. If they conceive with IVF or PGTA, you can offer a polar body biopsy, tropepectoderm biopsy, blastome ear biopsy, and in case there is a repetitive aneuploid embryo, repeated euploid losses or unbalanced translocation, then you can actually change the gametes, because if the egg or the if it's a husband's sperm, you can use a donor sperm. If the wife is having these problems, then you can use a donor egg. Actually, all these things can be there, and donor gametes can solve the problem.